Denise, for those that don't know you, why don't you just share a little bit about your background? You've been at Hillsdale longer than I've been at Hillsdale,
I
but talk
have.
about your journey if you would.
Sure, sure. So I've been here almost 30 years. And when I came here, there was not a registered dietitian
Yeah,
seeing outpatients. So I started our outpatient program here, working with outpatients and teaching people
yeah,
with diabetes on how to improve their health and how to navigate, how to make nutrition
yeah,
easier for
yeah.
them. Very
Speaking
clever.
of nutrition, it's that most wonderful time of the year again.
It is, it
Where
is.
we're glutton, we're eating all the turkeys and the potatoes
Yes,
and all those
yes.
sweet potato pies and all the good things. So,
Mm-hmm.
talk to us about some healthy habits.
So, what I recommend is just that people enjoy the foods they really love. And what
Okay?
I mean by that is we go to have Thanksgiving dinner and there's 20 items.
Yeah,
Maybe you don't like them all, but you put them on your plate because it's there. So, fill your plate with protein, first of all. Protein keeps us satisfied, helps our blood sugars when we eat all the other things, and then enjoy the foods you like the best. And my biggest tip around the holidays is to get a little bit more active. And I don't
right.
mean by exercising, but taking a 5 or 10 minute
Yeah,
walk, particularly after a meal, and has been shown to decrease our blood sugars. It helps with weight loss. It helps our digestion. There is study after study showing us evidence now that simply walking 5 to 15 minutes after you eat can really help your body and help prevent disease and insulin resistance in
is
the
that right?
future. So that's something any client who has seen
Yeah,
me, I would say, walk around your house for 5 minutes after dinner if
yeah,
you can't walk outside.
yeah,
Just get up, do the dishes,
right,
turn some
right.
music on and dance, march
Yeah,
in place.
yeah,
Just any movement after our meals will help reduce our
yeah.
insulin resistance.
So, Denise, one of the things that you mentioned was insulin resistance. Explain what that is. Explain what's happening
Sure.
in this environment because I'm
Yeah.
hearing a lot about it in my role.
Yes. Yeah.
Talk to our community a little bit
Yeah.
about what does that mean?
So I'm going to explain it as simply as I can.
Yeah.
Our bodies have a hormone called insulin that helps regulate our blood sugar. It's the one that is produced when our blood sugar goes high. It's not produced much when our blood sugar goes low. And what that insulin does is it picks glucose up from our bloodstream and literally carries it to the cells of our body, puts that glucose in the cells of our body, and that's how we get energy from the
Okay.
food we eat.
Okay.
When you have insulin resistance, those cells don't accept that insulin to open the door to let the sugar in that cell. So that sugar goes back into your bloodstream. And what that does is if you have type 2 diabetes, your blood sugar is going to go very, very high. If you have something else that isn't type 2 diabetes, it's going to still keep your blood sugar high.
Yeah.
And that consistent blood sugar being high or that consistent insulin resistance causes things such as prediabetes, fatty liver disease, non-alcoholic fatty
Yeah.
liver disease, polycystic ovarian syndrome, PCOS, and heart disease. And I would say fatty liver disease, prediabetes, and PCOS are the majority of people I see. And I'm not sure if we are just diagnosing those better now or if insulin resistance, I suspect, is greatly increasing in our
Yeah.
country. We know diabetes is increasing in our country. So here are 3 other disorders that are affected by insulin resistance, which can sometimes be hereditary or it can be caused by possibly the way we've eaten all of our life. We need to lower the amount of simple carbohydrates that we're eating,
Yeah.
and carbohydrates are not the enemy, but eating white starchy carbohydrates or white sugar by themselves does cause our insulin to increase rapidly, causes our pancreas to make more insulin, and if we have that happen over and over and over again, that can cause some insulin resistance. And we really talk about, remember the Mediterranean diet that
Oh, yeah.
came?
Yeah.
We know people in Europe
Oh,
don't
yeah.
have these problems. I've been teaching this since 1987, and we realize that that is the thing that helps insulin resistance as well.
Yeah.
You eat protein with your meals, low-fat proteins, lots of fruits and vegetables,
Yeah.
lots of beans, nuts, whole grains,
Right.
all of those things.
And you've told me before it's not a diet, it's a
No,
lifestyle.
it's a lifestyle.
And that's hard for some. So
Very
talk to
hard.
me about for the person who can't afford
Right.
some of those
Yeah.
things, Denise.
Yeah.
What are options available for those who are struggling
Right,
financially.
it is. And those options are things, inexpensive proteins like tuna.
Okay.
Beans is probably the best thing you can eat to combat insulin resistance,
Yeah.
and those are very lean,
Yeah.
very
Yeah.
inexpensive.
Sure.
Eating fruits and vegetables in season when they're on
Fresh,
sale.
on sale, get them from the
Fresh,
garden.
frozen, even canned.
Yeah.
It's better than not eating a vegetable.
Yeah.
Fiber is in whole grains. We live in a society that demonizes carbohydrates.
Right.
Brown rice, wild rice, whole wheat pasta. Pasta made from beans is
Yeah.
quite delicious.
Yeah.
Whole wheat pasta, whole wheat bread. Oats, these grains sometimes are relatively inexpensive and they're full of fiber, which can help prevent this insulin
Yeah.
resistance. So just always trying to find a protein you can afford and something with fiber. And that fiber is those grains, beans, nuts, fruits, and vegetables.
And consider it a lifestyle, not
Yes.
a diet. And you've always cautioned me about, there's a million different diets out there, Denise. And that can get dangerous, right? When we chase a specific,
It is.
diet here or a diet there. But one of the transitions that, before we have our last question, there's a lot of conversation about weight loss drugs right now.
There is.
Okay. And initially, the first use of the weight loss drug was to address diabetes. But now they're being used in patients sometimes who do not meet those qualifications.
Right.
So what is your take on that?
That,
And I would
yeah.
like your professional opinion.
Yep. So these GLP-1s,
Yep.
we're talking about Wegovy,
Yes.
Ozempic,
Yep.
Mounjaro,
The
all of
Ozempic,
these types
Mounjaro.
of medications
Solitude, yep.
are a very good tool to have for some people who are morbidly obese or who are obese, who aren't able to change or modify their diet any other way, or who have struggled with this their whole life.
Okay.
Obesity is such a complex disease.
It
It
is.
does not mean that someone is just not exercising
No,
and
or
eating
doing it
too
on
much.
purpose.
It's a very complex disease. There's hereditary factors, insulin resistance. PCOS is a disease that makes it very difficult for women to lose weight
Yeah.
hormonally. So these drugs are pretty helpful because they do control the hormones that cause us to be hungry and the hormones that cause us to feel satisfied. But it has to be done in conjunction with a nutrition plan
Yeah.
and changing behaviors of how you eat, how you react to food, how you cope with stress. I would say 80% of the people I see
Stress.
eat when they're stressed.
Stress
That's how
eat.
they cope.
We
Our
call it
bodies
stress
kind of
eating.
set
Yeah.
it up to that. I do that. I mean,
Well,
I
we
think
all
a
do
lot
it.
of people
Right,
do that.
we do.
So the thing that bothers me is when these drugs are just prescribed with
As a
no
virtue of it. Right.
Yep. So I think it's fine if they have that nutrition plan
Yeah.
and they're seeing someone to help them learn how to change behaviors
Yeah.
so that it's sustainable. Because those drugs really are intended to be used for a lifetime, but most people aren't going to do that.
Well, so that's why I want to ask you. So,
Right.
let's say an individual is prescribed Ozempic, right? And they're doing it as a measure of weight loss.
Right.
I have been told that it's not healthy to go on, go off, go on, go off.
No.
So, are they making a decision for life?
Some of them are. And I think I just listened to a webinar, and that's the intention of these medications, is that if you are a morbidly obese person
Yeah.
who struggles, this is something you're going to stay on for the rest of your life. Many people don't
Do you
need
support
to do
that or not support it?
I
As a
support it for
clinician?
the per individual.
Per individual, right? That's what
Because-
I mean. For
but-
the one who qualifies.
Yeah, I support it if
Yeah.
they're not losing too much weight. Because here's the flip side I see with Ozempic. My patients aren't eating.
Correct.
And so they're losing weight rapidly. And if you're at your
Not getting
normal body weight
nutrition.
and you keep going down, you need to stop taking that medicine because
Right.
you could get malnourished. And I am seeing that
Yes,
too.
and we're hearing about that more and more
Yeah,
right now.
So we have to really, it has to be person to person.
yeah.
Perhaps a woman that has PCOS, it might be a good thing for her to stay on
Yeah.
forever unless she starts losing weight. Because not only do those GLP-1s help you lose weight, they also help your kidneys, they protect your heart, may help with insulin resistance and those other things. So it really has to be case by case. And I feel like the providers in this community
They do.
use it
Yeah.
case by case.
Sure.
I've talked to other clinicians where that's not always what's
The
going
case,
on
right.
now. So it's a wonderful drug, but it is
But it needs to be
tricky.
cautioned,
It's
right?
very tricky.
And I
how to
also know
manage
some
it.
people that have lost a tremendous amount of weight who have suffered some coping mechanism challenges because that's a lot.
Yes.
When you take off that weight, there's a psychology issue going on
Absolutely.
as well.
Absolutely.
And so we often, even long ago, remember we used to do gastric bypass and those things, is a component of that is you had to meet with a counselor, you had to meet
Yes.
with a psychologist.
Yes, yes.
Because there is a psychological impact to weight
Oh,
loss.
absolutely.
Dramatic weight loss,
Yeah,
and the
absolutely.
coping mechanism. So I think we have to be mindful of that as that weight's coming off. The last point is I had a professional tell me that obesity is a choice, it's not a disease. And I disagree with that.
Yeah, I disagree with that.
Obesity,
wholeheartedly.
as it relates to pre-diabetics and diabetics and family history, it's a disease.
It is
Would you agree with
I would
that?
agree. It's a disease, and despite what some may try to do to improve their health
Yeah.
and lose weight,
can't
they
do
are
it.
not able to.
They cannot
and
do
it is
it.
not their fault.
Yeah, they cannot
I mean,
do it.
it's just genetic makeups and heredity.
Yeah.
Sometimes there's just
Sometimes that wins out over
does.
it.
Yeah.
Denise, as we close today, I want to talk a little bit about what's happening in your environment, which is telehealth. There seems to be some push and movement around getting access in rural communities,
Sure.
utilizing telehealth as a mechanism for that. What's your experience with that and thoughts regarding
Sure.
that?
So we just are starting that. We have we've had that approved.
Yep.
I've had two patients.
So there's been 2 now.
There's been 2.
Great.
Yes. So
How'd it go?
They're great.
Good.
And these are people who, because of our economy right now, one lived about 40 miles away
Couldn't
from
get
us
here.
in another town.
Yep.
One lived 30 miles. Didn't have the gas to come.
Correct.
One of them was ill.
Yep.
Has to stay at home for a while. So far, it's been working out really well.
I'm excited to see
So I
what
need
happens.
to get that word out a little
Yeah.
bit more. I've been offering it to people. At the end of the day, I want to meet with someone individually,
Sure.
and I think people
Sure.
like that as well.
But it's a good stopgap
But
method.
It is.
to
And
get
if
them the care
anyone
that they
lives,
need.
we're seeing a lot of people from Coldwater. I see a lot
Yeah.
of women
Yeah.
prenatal and
Yeah.
gestational
Yeah.
diabetes,
Yeah.
and they're enjoying that. So
Good.
it's
Good.
good. I think it's going to be. It's a service I just started last
Okay.
month.
So if I want
So-
to get some of that service from you and sign up, how do I do that?
Yep, they can call the hospital and
Okay.
ask for the dietitian.
All right.
That would.
It's a
hard.
good access. Denise, it is absolutely always a pleasure
Thank
to
you.
meet with you,
Thanks
and
for
you're
having
doing
me.
such a great job.